Then we have benign prostate hyperplasia. Yeah, hyperplasia. Of course, some books will talk about benign prostate hypertrophy. So in this case, the cells of the prostate are increased in number. If you talk of it being hypertrophy, it is the cells that are enlarged in size. And all of them, of course, has the effect of finally causing the prostate to enlarge. Yeah. Of course, when you examine a patient in a clinic, you will not talk of benign prostate hyperplasia. Usually you do digital rectal exam, you examine, you put your finger through the anal region to feel the prostate. So you may feel it is enlarged, and maybe from the ultrasound, it will tell you it enlarged. But of course, in that case, you cannot talk of it as benign prostate hyperplasia. That is a possibility, but you talk of it as benign prostate enlargement, because hyperplasia is a histological diagnosis. Even hypertrophy, you have to look at it under the microscope to say the cells are increased in number or they are increased in size. So it's a nodular enlargement of the glandular and stromal elements of the prostate. So it has the connective tissue, and also the glands themselves are they are enlarged in a nodular way. So glandular, you have mostly hyperplasia. That is, the gland tend to increase in number. But the stroma, the connective tissue, tend to be increasing in size, so hypertrophy. So you can have both hyperplasia and hypertrophy. So usually affect transitional and paraurethral components. So the component that is paraurethral is around the prostatic urethra. That is where mainly hypertrophy takes place, and transitional part. So the prostate enlarges in all men from middle age onward. Most of the time from 50 years and above, they tend to enlarge, probably because of alteration in hormone balance. You remember at that age, most of the time in younger men, the predominant hormone will be testosterone. But once they reach 50 years and above, the testosterone levels start getting low. And so in comparison, the other hormone, including progesterone and maybe estrogen, will tend to increase in comparison. Of course, the testosterone will still be more. That in itself will be what causes the prostate to start enlarging at that stage. So it can also, of course, it can produce obstruction to bladder outflow as a result of pressure on the prostatic urethra. You remember, the prostatic urethra passes through the prostate itself. So when it's enlarged, it makes it narrow, or it narrows it, and it can actually block it. And so basically, when we take a history of a patient who has prostate issue, they will talk of maybe difficulty in passing urine. They have to strain a lot for urine to come out. They have to urinate several times in a day. So we have what we call frequency of micturition. So they have to, even at night, we can have what we call nocturia. So they have to wake up several times to urinate. Instead of maybe once or twice, they may even go up to 10 times. So you can imagine if somebody has to urinate 10 times at night, the quality will be greatly affected. And generally, all those symptoms, and then there may be what we call urgency. As in when the bladder is full for a male at this age, where the prostate has enlarged, when they feel the urge to urinate, usually they have to rush very fast. Otherwise, the urine is likely to come out before they reach the toilet, for example. That's what we call urgency. So all those symptoms, urgency, dysuria, difficult passing urine, having to strain, nocturia, all those we call them lower urinary tract symptoms. So those are the things you ask in an elderly male to find out whether they have symptoms of obstruction of the prostate. And of course, sometimes it may completely block. So somebody may come with urinary obstruction. So they may come with full bladder. They're not able to pass urine because completely the prostatic urethra is completely blocked because of the enlarged prostate. So when you have, of course, blockage, if you are to block urine at the urethra, at the prostatic urethra, so you will end up with what we call hydroureter. Basically, because there is backflow from the bladder, once it's full, overfill, it's able to backflow into the ureters. And that is why you end up with hydroureter. Hydro is water. So the ureter is distended because it's filled. Of course, in this case, is urine. Then, of course, if you don't control it, it will continue moving backward all the way to the kidneys. So you end up with what we call hydronephrosis. And of course, if this is not well controlled, you end up with what we call obstructive uropathy. you can even end up with failure of the kidneys. And of course, that obstruction predisposes to infection of the kidney, which we talked about when we talked about the kidney. So it will predispose to infection and even stone formation. So you're likely to form stones in the kidney, in the ureter, or even in the bladder because of stasis of urine. So usually peripheral zone is not involved in the hyperplastic process and becomes compressed and atrophic at the outer margin. So in case of BPH, the peripheral zone, that is mostly the posterior part, is usually not affected. So mostly is the periprostatic area that is affected. And so this part that is not affected tend to be compressed and become sometimes atrophic. So when you look at the incidence of BPH, it's about 25%. If you look at people who are 40 to 60 years, 25% of them are likely to have BPH. And then for people over 60 years, 40% of them, so if you have to take 100 people who are over 60, 40 of them will have enlarged prostate. However, it's good to know that not every male will be affected. Some male will be even at 90 and they never have any problem with their prostate. They may be enlarged, but it doesn't block the urinary system. So that is looking at the hyperplasia. You can see basically histologically. You can see the stroma also. When we say the stroma, mostly tend to be hypertrophy. And when you look at the glands, you can see the epithelium there, they tend to be hyperplasia. That's why we are talking about double layered epithelium. So there is hyperplasia of the glands. Yes, and you can see convolution. You can see that corpora amelisea. This one is common, especially in the elderly. It's basically concretions within the ducts of the glands. Yeah, and it is thought that it is caused by those cells, the necrosis of cells, the epithelial cells, and forms like a concretion within the glands of the prostate. Usually, most of the time, it is known to be benign, but a few cases can be related to cancer of the prostate. Of course, there we are looking at the three prostate, those diagrams. We have a normal prostate. You can see the prostatic urethra is well open. And then you can see in cases of benign hyperplasia, you can see it is usually the periurethral nodular hyperplasia. So the part that is around the urethra is what usually become hyperplastic and may cause compression of the urethra. So it may even block it completely. And that is why somebody may come with completely inability to pass urine. And then in case of carcinoma, it tends to affect the peripheral zone. So you can see where it's located. It doesn't seem to affect the periurethral area. And that is why usually for cancer, sometimes it may not cause blockage. But however, with advanced cancer, it will still affect the entire prostate. And it may even cause blockage of urine completely.